Welcome to this module about blood glucose awareness training, which is a very helpful technique in improving diabetes self-management. The most important aspect to be learned in this module is it is important to learn the symptoms of hypoglycemia. It may sound odd to you, but recognizing a hypoglycemic event is very difficult for many patients, and it's becoming more problematic as longer the patient has diabetes. Having a hypoglycemic event is of extreme risk for the patient, not only affecting quality of life, but also directly increasing cardiovascular morbidity and mortality of the patient. Studies show that the patient having the first hypoglycemic event are able to recognize the situation correctly. But already at the second hypoglycemia, they lose between 30 to 70% of the ability to recognize the hypoglycemia or certain glucose levels. The window of glucose level which can be recognized by the patient continuously narrows down, and this is risky. That constantly increases the risk of losing consciousness for the patient. And in addition, it increases the risk of the patient not being able to react on low glucose level, which further potentiates the risk. The good news are, recognizing these symptoms can be learned. Learning on a cognitive level to understand early signs of vegetative symptoms of an hypoglycemic event can help to regain the awareness of hypoglycemia. Throughout the past, numerous programs to learn blood glucose awareness or hypoglycemia awareness were developed. In general, cognitive, emotional and behavioral symptoms and signals are used to replace the missing recognition of hypoglycemia symptoms. In this module, you will learn about the blood glucose awareness training, short BGAT, one of the most popular programs for hypoglycemia awareness training. Developed already in the 90s in the United States, it's still one of the most and best evaluated programs for this topic worldwide. You will learn about its main idea and its method to understand how you can support a patient suffering from disturbed hypoglycemia awareness. So what is the message to take home for the BGAT program? At first, it is important to learn the symptoms of hypoglycemia. Secondly, improving hypoglycemia awareness is a helpful tool to achieve better blood glucose values in the therapeutic range and to improve quality of life for the patient. Besides, using the BGAT program can refresh the understanding of the dynamics of insulin, carbohydrates and physical activity for the patient. And finally, although BGAT cannot replace a regular diabetes education program, self-monitoring of blood glucose and BGAT together can help to regain the awareness of hypoglycemia. And this is important.